Ready to go. We have a quorum. Oh, Stephanie, welcome. So, good morning, everyone. My name is Joe Mihevik, and I am the chair of the Board of Health. The board secretary has confirmed that we have a quorum, so I'll start meeting number 39 of the Board of Health to order. Welcome, everyone. Today's meeting is being held with board members and city staff participating both by video conference and in person at City Hall in Committee Room 1. City Hall is open to the public, and anyone is welcome to attend the meeting in this room at the City Hall today. The public may continue to participate electronically by video conference. The meeting is also being live streamed online at youtube.com/Toronto City Council Live. And of course, we're asking for patience, given that we might experience technical delays. The clerk's office will connect remote registered public speakers to the meeting by video conference. The list of speakers can be viewed online by visiting the Board of Health's webpage at toronto.ca/council and by clicking speakers box for today's meeting. We have one speaker so far registered for the very first item. Yes, the COVID item. We will close the speakers list at 10 a.m. Okay, the board secretary has also emailed the speakers list to directors. So directors, members of the Board of Health that is, this is a paperless meeting. The board secretary has provided all agenda material on toronto.ca/council and via CMP, the clerk's meeting portal. Directors, please keep in mind to keep your mic muted unless you wish to question staff or speak on an item, and ensure that your video is turned on. As part of each agenda item, I will ask directors to raise their hands or unmute their mic if they wish to speak or question staff or speak. I will then create a speakers list and will call on directors when it is their turn to speak. When voting on an item, I will ask directors to ensure that they turn on their video and raise their hand so that it's visible to the clerk to indicate their vote. Directors, I want to remind you that you must submit and approve your motions by email. Staff are available at boh@toronto.ca to help with the motions. Trustee Stephanie, do you feel comfortable doing the land acknowledgement? I understand that role is shared. So over to Trustee Donaldson to do the land acknowledgement statement.
Thank you. Although we are in different locations and meeting remotely today, the Board of Health would like to acknowledge that the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Thanks.
Thank you very much. Are there any declarations of interest under the Municipal Conflict of Interest Act? If you have an interest, please raise your hand or unmute your mic and indicate the item number and the nature of your interest. Seeing none on screen, seeing none for directors present. Thank you. May I now ask for a motion to confirm the minutes of our last board meeting on June 20th, 2022, moved by Trustee Director Donaldson. Any debate or discussion? Seeing no one with their hand up online or in person. All in favor, opposed if any, if you could raise your hand just for a sec. Thank you very much. Carried. Okay, before we get into the agenda, I do want to note that this is the last meeting of the Board of Health for this term. And I want to, recognizing that I'm a little bit, as I often say, a little bit of an interloper here, and have only carried this ball for 6 months. But I do feel I want to speak on behalf of the Board of Health and give a real deep thanks to our public health staff for this last term. You have worked long, hard, difficult hours protecting this city. Yes, people died and got sick because of COVID in our city, and each and every one of those persons has a story, has a family, has a connection with this city. And we mourn and grieve with those families and friends, and I think that added a level of angst to the work that you folks did. However, at the same time, we, the board, leave this term knowing that public health in Toronto was in good hands and is in good hands. Committed, passionate, smart folks with their eyes on the ball. And you know, we have, certainly in academic literature, emerging academic literature, or articles that go around the world, Toronto is recognized as a world leader in terms of vaccination rates being high, and in terms of sickness, death, hospitalization being lower amongst global cities. That is an amazing accomplishment, and for that especially, we are thankful to public health staff. You know, I do see patterns here, and maybe it's a pattern that maybe John also sees in the amalgamated city. Do you remember the smoking bylaw and the heat that we took during the smoking bylaw? Or the pesticide bylaw, Councillor Perks, or the Dine Safe bylaw? Public health is that part of city life that sometimes has to challenge our behaviors, go up the river, and point to things that we need to do, like take vaccinations, and things that we do that aren't so smart, like smoking, like pesticide use, and so on. This gets us into trouble from time to time, particularly with that part of us or those parts of society that resist change, even positive change. Good public health units, it seems to me, to my mind, this is one of the benchmarks, should always be in at least a little bit of trouble if they are doing a good job. And I think you did some good trouble this last term. And for that, I think on behalf of the Board of Health, I know I speak for all of them, we are thankful to staff and the partnership that you had with the board in fulfilling your job. Lastly, I do want to say that my experience in the last 6 months with Dr. Davila, with senior staff, with directors, has been nothing less than exemplary, cooperative, graceful. Gracefulness under stress, I think, might be a way to put it. And I leave this knowing that this position, and I think the Board of Health leaves their positions knowing that public health is in good hands. So thank you very much, Dr. Davila, and through you to all the staff here present and all the staff watching and all the staff that do the great work that you all do. Shall we proceed with an agenda review?
Mr. Chair,
Yes.
with your permission, might I take a few moments for a few words?
Sure, yes, absolutely.
So thank you, Mr. Chair. I did just want to take this opportunity to express thanks and sincere gratitude, one, for your kind acknowledgement, and this is on behalf of all the Toronto Public Health staff who've worked tirelessly over this term to carry out the board's direction and to keep Torontonians healthy, as you said. If I may, I would like to also take this opportunity to acknowledge the members of the Board of Health, both those here in person and those that are joining us virtually. Members of the board, I imagine that when you signed up for this role, you could not have imagined what would have been what we were in store for together. This has unquestionably been a challenging and a unique time for all of us. I am truly grateful for the depth of knowledge and the diversity of experience that each of you has brought to the Board of Health, and for your unwavering commitment to the health of millions of Torontonians, even during the COVID-19 pandemic's most difficult moments. Your leadership has played a critical role in ensuring the success of Toronto's response to the COVID-19 pandemic, as evidenced by the high rate of vaccination and the low rates of severe outcomes we see today. Although COVID-19 has loomed large over most of the term, I would be remiss if I did not acknowledge the other important work that this board has helped move forward. Responding to the drug poisoning crisis and advancing a pathway towards decriminalization, the Toronto Indigenous Health Strategy, and expanding access to dental services for low-income Torontonians, to name just a few of the initiatives that have been undertaken under your purview. I also think it's important that we acknowledge the immense contributions of former board members, including our former chair, Joe Cressy, former vice chair, Kristen Wong-Tam, former councillor members, Jennifer McKelvey and Brad Bradford, and the late councillor Cynthia Lai. All of them were tireless advocates for Torontonians, as well as the neighborhoods and communities they represented. In particular, their voices and contributions were an immense asset as we sought to implement an equity-focused COVID-19 response that met the needs of Toronto's diverse communities and its most vulnerable residents. And of course, to you, Chair Mihevc, a big thank you, a huge thank you for coming back to City Hall to take on the important and demanding role of chair. Your steady hand, your guidance and stewardship, and your deep, deep knowledge of Toronto public health, past and present, have been most welcome and extremely valued at this important and transitional time as we enter a new phase of our relationship with COVID-19 and begin to expand our horizons to other pressing public health issues. So in closing, regardless of where your future endeavors take you, and I've heard just a little bit before this meeting, please carry with you my sincere gratitude and admiration for the effort and wisdom you have dispensed in service of the Board of Health and in service to all Torontonians. Thank you, Mr. Chair.
Thank you very much, Dr. Davila, for your kind words for the board. Yes, okay. So let's get on to business. There are 4 or 5 items on the agenda, but first I'll move a motion to accept deputations until 10 a.m. Okay, we don't need seconders, right? No. Moved by myself. All in favor of that? Opposed, if any? That's carried. So we have 4 items, so we'll go through rapid fire first. Really, there's only one that I think we can pass. So 39.1 is the update on COVID-19 response and other public health issues. We're holding that because we have a presentation. The second is 39.2, Toronto Public Health 2003 operating budget submission, holding that for presentation, which we can do, will do, in conjunction with 39.3, as both have the same presentation from staff. Toronto Public Health 2023 to 2032 capital budget plan and plan submission. So we'll hold them together. So the only one we can really move in short order is 39.4, which is requesting appointment to the Board of Health that reflect the diversity of Toronto, knowing that there's going to be a flood of applicants wanting to be on this board. We want to make sure that we want to encourage that group of people on City Council that will be choosing those folks, to encourage them to understand and find folks that represent the diversity of Toronto. Can we move that forward, or does anyone want to hold that? Okay, all in favor of 39.4, opposed if any, that's carried. Okay, so we'll go back to the top of the agenda, where we will start with an update on COVID-19 response and other public health issues. I'll pass the baton to Dr. Davila, who I understand is going to pass the baton to others.
So thank you, Mr. Chair. I'll just make a brief introduction to our 2 presenters today. As you mentioned in your remarks this morning, Mr. Chair, we do have a fabulous team of people, a fabulous team of professionals that have worked very hard over the course of this term of the Board of Health, and in particular, leading the charge are the two Deputy Medical Officers of Health who are going to be giving the presentation today, Dr. Michael Finkelstein and Dr. Nakoshi Lamptey. I feel very, very privileged to be able to call these two colleagues and friends. They are truly remarkable professionals who do great work in service of this city and in service to this board. So with that, I'm going to turn it over to Drs. Michael Finkelstein and Nakoshi Lamptey to present.
Good morning. Thank you, Dr. Villa. First slide, next slide, please. Back one. Okay. As the weather changes, as we all move more indoors, the respiratory season starts. This season is more complex as we are seeing recent increases in COVID-19, respiratory syncytial virus, and influenza. We are in a different time and place. Many people have been immunized, and many people have been infected by COVID-19, which provides strong hybrid immunity. The last two winters, the main pressure on healthcare was COVID-19. This season is more complicated as we are seeing that is COVID along with respiratory illnesses like flu and RSV that are causing illness. However, it is clear that vaccines are key to low COVID-19 illness severity. Also recently, we have detected a small number of new COVID-19 Omicron subvariants, which have been detected in Ontario, likely contributing an increasing proportion of cases. But we all know that a seasonal response will build on successful COVID-19 partnerships and learning, which supports an integrated respiratory response. Next slide. It has been a long journey. It has been 1,018 days since the detection of the first case of COVID in Toronto on January 25th, 2020. Here you can see the tremendous efforts that TPH and other partners have expended in response to COVID-19, such as the over 370,000 cases of COVID that we have detected and managed, and over 4,500 outbreaks that we have managed within TPH's staff. Next slide. This graph shows the number of positive tests for respiratory viruses other than COVID-19 by surveillance week for Canada. Although the fall and winter respiratory season officially starts on September 1st, viral activity and transmission can vary from year to year, and we have seen many indications that the season has already begun, including, as you can see, confirmed positive tests for a range of respiratory viruses are increasing. And combined, these are contributing to an overall burden of illness, which we've seen in our hospitals lately. And it is important to remember that one of these viruses, influenza, is preventable by vaccination. And you can see the number of positive tests have increased in every week since the beginning of the season. Next slide. This slide shows the current respiratory disease activity in Ontario. You can see on the left that COVID-19 activity remains high but stable. It's not growing substantially. While on the right you can see that influenza activity is moderate currently and also increasing. This is another opportunity to remind people about the importance of vaccination to prevent both of these infections. Next slide. Now let's turn to an update on COVID-19. Next slide. So as I just indicated, we are seeing an emergence of two Omicron subvariants called XBB and BQ1. And while we are learning about these new variants, we now have experience with coronavirus, and we know what can reduce the risk of severe illness, which includes vaccination, antivirals, and the ways of preventing disease overall. These two Omicron subvariants are being continually monitored by Public Health Ontario and being assessed by transmissibility, how fast they move between people, their severity, how much illness they cause, and their ability to escape our immune protection, both naturally induced through infection and a vaccination. But we do know that these two subvariants are increasing as proportion of new cases. Next slide. So here you can see the hospitalizations and ICU admissions that have been caused by COVID-19 up until the mid-October. And despite an increase in cases, we are not seeing an increase in severe outcomes that we saw in the first Omicron wave. This is likely due to population with better overall immunity due to immunization, boosters, and previous infection with COVID-19. So as we've heard in our media, hospitals are under tremendous pressure due to the amount of respiratory diseases. COVID-19 hospitalizations in Toronto are currently relatively low. However, it is still important to get ready for a wave that may be coming due to waning immunity, which is why we need people to continue to get a fall booster, as vaccines have helped us get to this remarkable picture where our hospitalizations in recent waves have remained low. Next slide. So the key message: we all need to maintain these layers of prevention. Stay up to date with vaccines and access treatment if you're eligible. Wear your mask indoors in crowded spaces if you feel comfortable doing so, and try to socialize outside where possible. These layers of protection also are successful at preventing other respiratory diseases. And now over to my colleague, Dr. Lind.
Thank you, Dr. Finkelstein. If we can move to the next slide, please. I'll speak about vaccination. Vaccination remains a key part in protecting public health. Toronto Public Health continues to promote and provide COVID-19 vaccination and boosters, along with routine immunizations and specific vaccines for outbreak response. Here on this slide, you can see that we are extremely busy in this work. We respond to COVID-19 while we're also returning and rescaling non-COVID-19 related functions. You can see here that in our work, there are several immunization programs, and that includes offering many vaccines in our mass immunization clinics, as well as through our mobile teams. If we can move to the next slide, please. Team Toronto continues to provide and facilitate vaccine access for COVID-19. And we're very encouraged that the public is responding to the need for boosters now. This figure shows the number of third and fourth COVID-19 vaccine doses administered weekly to Toronto residents between May 1st and November 2nd, 2022. You can see that there was an increase in the number of doses administered in mid to late July, and then another increase in the weeks following the approval of the Moderna and Pfizer COVID-19 bivalent booster vaccines. The Moderna bivalent booster became available for eligible Toronto residents age 18 and older on September 26, 2022, followed by the Pfizer bivalent booster becoming available for eligible Toronto residents age 12 and older on October 17, 2022. This data was extracted before the week of November 6th was complete, so there's a little bit of an artifact there looking like the volumes are low, but we can tell you that our clinics are steady, they're busy, and the public is coming out to take advantage of the protection that a bivalent booster can offer them. In fact, in this time period, we've had, since May, 612,700 vaccine doses administered to Toronto residents. And I continually remain stunned and impressed by the great public participation in the program to protect themselves and their community. So we've learned and reinforced that getting to a high and protective rate of coverage does not involve just administering the vaccine, people have to understand and feel encouraged and supported to come out and take advantage of that. And so we continue to explain and promote opportunities for people to ask questions and to learn about the vaccine and how it can benefit them. Very recently, October 27th to 29, 2022, TPH sent over 300 broadcast voice messages from our esteemed medical officer of health to Torontonians on their cell phones and landlines to promote a town hall, which would encourage them to make an appointment and to participate in the conversation about the COVID-19 bivalent booster. Through these broadcast voice messages, over 10,000 people requested more information about the vaccine, and nearly 2,000 were patched through to the Provincial Vaccine Contact Centre to make a vaccine appointment. We had a very successful town hall on November 1st. There are more scheduled on November 30th and December 15th. My wonderful colleague, Dr. Vanita Dubé, was the speaker, and we had other staff, including our director, Nicole Welch, present. And in that town hall, over 24,000 people joined it for an average time of 15 minutes. And again, more people passed through the vaccine center. In fact, this is the highest number who did so since the last town hall with Dr. Davila and Mayor Tory on June 2nd, 2021. So we look forward to the upcoming town halls and more opportunities for people to ask questions and get immunized. If we can go to the next slide, please. As Dr. Finkelstein stated, influenza activity has already started nationally, provincially, and even here in Toronto. As of November 7th, we've had 2 confirmed influenza outbreaks in institutions and 417 confirmed cases. We expect that as the weather gets colder and people spend more time indoors, that we will get more cases of influenza. And so we are encouraging everyone to get their free flu vaccine now to prevent infection and protect our communities. You can receive the flu vaccine at the same time as a bivalent COVID-19 booster, and we actively offer that anytime someone comes to our TPH clinics. Efforts to administer influenza vaccine began earlier in congregate settings where the impacts of influenza can be more severe, and immunizing teams, including TPH mobile teams, continue to mobilize in settings like shelters and naturally occurring retirement communities to provide COVID-19 and influenza immunization. Next slide, please. I'll speak shortly about childhood immunization assessment, which is an important part of our core routine public health functions that we're resuming and rescaling in the midst of our ongoing COVID-19 response. We can go to the next slide, please. The Provincial Immunization of School Pupils Act requires parents to submit records of their child's routine childhood vaccines or a valid exemption for the what we call antigens or pathogens listed here on this slide. Toronto Public Health's role in the Immunization of School Pupils Act is to assess vaccination records to ensure that students are compliant, and this helps prevent illness and also make us assessments if there should be an outbreak of what interventions might be required. Currently, Toronto Public Health is focused on informing families about potentially missing doses and records so that they can catch up on these vaccines. The efforts to inform families not only includes individualized letters about missing doses or missing records, we are also in general promoting the importance of immunization through materials such as advertisements in bus shelters. So this work to notify families will continue throughout the fall, and we're continually assessing the scale of that effort as we get records and get a sense of what might be missing. And with that, I'll turn it back to my colleague, Dr. Finkelstein.
Thank you. Next slide, please. TPH continues to prepare and respond to outbreaks as required by incorporating lessons learned from the COVID-19 response. This work is aligned with our Toronto Public Health interim priority number 1. Next slide. And so here are some details of current or recent outbreak responses. TPH has responded quickly to recent outbreaks of monkeypox virus and meningococcal C bacteria. Much of this success came from years of trust building that laid the foundations for success. TPH has worked previously with community groups and has connections through previous engagement that was leveraged during the response. Our key success factors include leveraging our existing partnerships through previously built partnerships with key stakeholders such as newcomer community health agencies and the gay, bisexual, and MSM community. TPH has learned and adapted based on our experiences and lessons learned from COVID, and then has applied them, for instance, to our monkeypox response. In the Men-C response, this was an example of using limited resources as best as we can, given priorities at that time, which were mainly focused on COVID. We are also continuing to have outbreaks that we are managing and continually monitoring for other risks, such as Ebola. And you can see here that we've also learned from COVID-19 experience, such as scaling up of disease investigations and moving vaccination efforts into our community locations where possible. Next slide. And here are some results from our monkeypox case, for monkeypox outbreak response. As you can see, monkeypox cases in Toronto continue to decline. The monkeypox cases in Toronto peaked in mid-July, and we have had no confirmed cases in the recent past 2 weeks. And as of the end of October, TPH has administered more than 27,000 pre-exposure prophylaxis vaccine doses. And we continue to administer vaccinations, now recommending a second dose for individuals who have received their first dose. 99% of confirmed monkeypox cases have been males, which is consistent with the global epidemiological trends. The majority of Ontario monkeypox cases have been in Toronto residents, and we account for 73% of provincial cases. And we have administered the vast majority of vaccine doses. Next slide. I'd also like to briefly talk about our meningococcal C outbreak response. The public health response in Toronto in this outbreak is ongoing. There have been no additional cases recently detected, and the probability of infection to the public remains low. Individuals involved in this outbreak were born outside of Canada and were not immunized against meningococcal disease. And Toronto Public Health continues to encourage residents between the ages of 20 and 36 who have not yet received a dose of meningococcal vaccine to be vaccinated as soon as possible. And we are offering this publicly funded meningococcal vaccine at our City 6 fixed site immunization clinics, and it also is available at some primary care clinics. Next slide. So in wrapping up the presentation, some key messages that we should remember. That layers of protection that I spoke about work to prevent illness. The vaccine against COVID-19 and against other infections works best when you get all the eligible doses that you need. TPH continues to respond to other urgent and emerging issues while continuing to scale up non-COVID related functions. And the last slide is a recommendation back to Dr. DeVilla.
So thank you, Drs. Lemke and Dr. Finkelstein. As you can see, we do have a recommendation slide here suggesting that the Board of Health requests that we come back with a report in the winter of 2023 when the new term of the board convenes with an update on the respiratory season in Toronto, which would include, of course, information regarding COVID-19 and the response at that point in time, and as well a perspective on that which is happening from an influenza perspective and other respiratory viruses. So with that, Mr. Chair, we'll hand it back over to you. I will thank my colleagues for their presentation, and I suppose we can continue on with the rest.
Yes, thank you very much, and I'll echo the thanks for your presentation. Before we get into questions from the board, we do have one deputant. His name is Danielle Freedom, and I understand this is an online deputation. So with the help of technology,
There we go. I think I'm on.
oh, there you are, great, this is working.
Great.
Okay, welcome
That's
Danielle, you have 5 minutes for your presentation, we welcome it.
Thank you very much. My name, as you know, my name is Daniel Freiheit. I think they had it there as freedom. That's the same term, just the German version of freedom. I'm a Toronto resident and a father of 4, and I actually applied to be a public member of this board, and hopefully the councillors have had a chance to review my bio. But that's not the purpose of my delegation today. But first of all, I want to thank all of you for your service. I know it is a thankless job, and it's a stressful job, and it's a darned if you do, darned if you don't kind of role. So your service and commitment and your dedication is acknowledged. The reason I'm here today is to ask this board to address ongoing COVID vaccine mandates in particular that much of the public is unaware about. Many folks think that the COVID mandates were dropped when the province, the cities, and the federal government dropped them. But surprisingly, many private and semi-private institutions have kept them in place. And I recently learned, including the City of Toronto, based on a recent arbitration decision. And the irony is that these mandatory vaccination policies are actually, at this point, in my view, and based on my experience dealing with a lot of members of the public, is that these are detrimental to Torontonians' well-being. And I just wanted to see by a show of hands who on this board is aware that there are still schools in the GTA that require children to get vaccinated with the mRNA vaccine in order to attend an independent school. Just wondering if the board was aware of that. Okay, I'm not seeing a show of hands, but it's possible that this is not interactive as I thought. And can I see just by a show of hands who on this board is aware that some employers still have a policy? Well, I guess you're all aware of this because the City of Toronto still has a vaccine, a COVID vaccine requirement for employees. And I'm assuming you all knew that this policy is still in place, just by a show of hands. Yeah. Lastly, I wanted to see by a show of hands who on this board is aware that that the impact of the Pfizer vaccine on subfertile individuals remains something that, quote, needs to be urgently studied. And this is according to a recent journal in Andrology in June 2022. So the issue is that these vaccines are having side effects that weren't exactly anticipated when they were initially rolled out. And this is through real world data that's now coming out. And it's important to balance those additional incoming information as this board promotes additional vaccination, but especially for this board to speak out against ongoing mandates. I think this board's policy, or the goals of this board, are to maintain and improve the health status of Toronto's population, and 2, to reduce inequities in health status. And I believe that the board can take 4 important steps to fulfill its mandate today. First of all, I think the chief or the associate medical officer needs to issue a communication immediately clarifying that the vaccine does not stop transmission. I think this is a point of confusion that is resulting in a lot of ongoing mandates in schools and independent schools and in workplaces, including the city's own workplace. The arbitrator in the decision that I just learned came out, the arbitrator was using a will say statement of Dr. Dubé that's very outdated. We now know that transmission, and Dr. Finkelstein confirmed it this morning, the vaccine does not stop transmission, and many employers are issuing mandates on the hope or the belief that forcing all their employees to get vaccinated will stop workplace transmission, but it's not doing that. And employers have to focus on other methods like flexibility with remote work and improving air quality in workplaces. 2, I believe this board should communicate to the Ontario Federation of Independent Schools that COVID vaccine mandates for children is not a policy that is supported by public health at this point in the pandemic. 3, I believe this board can issue a communication to private companies and institutions that workplace vaccine requirements, although advisable, should not be used to exclude unvaccinated individuals from employment or education, just because, not only because there are unknown impacts on fertile individuals that require urgent study, but because this type of exclusion is creating a massive social rift and is detrimental to public health. Last but not least, I believe this Board of Health should be communicating with the College of Physicians and Surgeons of Ontario and the Minister of Health as a backstop to ensure that the medical exemption guidelines that were published originally in January of 2022, those guidelines need to be relaxed. Many doctors who would otherwise provide patients with medical exemptions are confused by these legacy exemptions.
Danielle, can you wrap it up? I'll give you 15 seconds to wrap it up.
Yeah, those guidelines just needs to be updated to make sure that those who qualify for exemptions can be provided for them. Thank you very much. If there's any questions, I'm available anytime to respond.
Great. Thank you, Danielle. Are there any questions of the deputant? Either from folks here or online? Seeing none, Danielle will just say thank you for your deputation. Much appreciated.
Thank you very much.
Okay, now we take it into the board. Are there questions of staff? I see, I'll just start making a list. Councillor Fillion, maybe you start, but does Trustee Donaldson? Is that Kate? Yes, okay, Kate, thank you. Anybody else? Okay, thank you, and I'll put myself down at the end. Okay, starting with Councillor Fillion.
Yes, thank you very much. Just wondered, are we giving out both, or administering both bivalent vaccines, and do people have their choice, and would it still be the case that the two are interchangeable?
Through you, Mr. Chair? Yes.
Yes.
We are administering, we
all of
offer
those,
both.
yes.
And yes, people could receive either one.
Great, thank you. With the flu, the RSV, and COVID all, being pretty active this winter, is there any way to, is there any simple way to tell the difference if somebody's sick, which one they have, or are the symptoms so similar that it's, very difficult to tell, and does it make any difference? Would you treat them all the same anyway?
Through the chair, the signs and symptoms of these respiratory viruses are all very similar, but they can be treated in different ways. So for instance, for COVID-19, for individuals who are at higher risk, there is antivirals that can be given. For influenza, the same thing. For people at high risk, if you are diagnosed quickly, there is antiviral therapy. So it is important, if you are at higher risk and are eligible for testing, that you go for testing so that people can understand what they're being infected with, so that their physician or healthcare provider can provide the appropriate response. And so that's important. There are also rapid tests that people can take at home that will also help them determine what virus they may be infected with.
Are there rapid tests for the flu as well?
There are rapid tests for the flu. Those are usually used in places like hospitals and in institutions like long-term care, because they require a bit more care in interpretation.
Okay, that's great. So if you're at higher risk or very sick, you should figure out which one you have by going and getting tested, because it might be Paxlovid for COVID and a different antiviral for the flu.
Yes, Tamiflu or oseltamivir can be taken for influenza.
Okay, great. Thank you. That's really helpful. With the new vaccines that target the more recent subvariants, is it the case again, or do we know the extent to which it's the case again that the vaccine actually significantly reduces your risk of getting the virus? I know that it's well documented that it reduces your risk of severe illness, but to what extent does it actually protect you from catching it?
For you, Mr. Chair. So I think we would have to extrapolate from our experience from previous formulations of the vaccine, because the bivalent boosters were studied in terms of their antibody response. So we do know that the bivalent booster provides a very robust antibody response, but we would have to have more experience with following people over time to see to what degree it reduces your chance of infection. But just based on extrapolation from the antibody response, we do believe that it's going to provide a boost of protection to lower your chance of infection. The main reason we encourage people to get boosters right now is to boost to prevent severe infection. That is what we are most concerned about at this stage, keeping people well enough so that they don't have to end up in hospital.
And do we have any specific stats on that if we wanted to communicate to people how much, the extent to which they're protected from serious illness based on, you know, when they got their most recent booster or how many they've had? Do we have data on that? I know I used to ask this 6 months ago and we didn't have the data then. Do we have any more of it now?
Through you, Mr. Chair, again. I think probably the best way that we could explain this is not so much from the bivalent boosters, but what we observed with people getting their third and fourth boosters. We definitely saw a decrease in the risk for hospitalization, particularly for people age 60 or 65 years and older. You can see there's a big difference between, in that group, their rate of hospitalization if they had had a recent dose and those who had not got a third or fourth dose. That's probably the most.
And is there somewhere where I would find those stats?
For you, Mr. Chair, I'm sure we can follow up afterwards.
Okay, great, thank you. And last question, with the flu, am I correct that it's much more the case that getting the vaccine actually has a high degree of preventing you from catching the flu, not just the severity of it if you do get it?
So each year, the influenza vaccination, we need to learn about the match between the vaccine and the circulating strain of influenza to be able to answer that question. So looking at our recent past with the experiences in other countries, we have seen that the vaccine can reduce your risk of influenza, and also it does decrease your risk of more severe illness, just as similar to the COVID-19 vaccine. But to have the specific answer to your question, you really have to wait into the season to see how the vaccine is working in our community. So the jury is still out on how effective the vaccine will be this year on doing the things you just described.
So it could vary from year to year. Historically, my understanding, but I'm not sure if it's correct or not, is that there's always been a pretty high degree of protection from actually getting the flu, historically, if you go back over the last, I don't know how many years.
Through the chair, as I said, it tends to be highly variable. Some years the vaccine is better matched to the circulating strain and you get superior protection. Some years the virus will change during the season and make it less effective. And so certainly some years the vaccine has been very effective, others less so.
And is it always more protective against serious illness, like the same as with the COVID vaccine?
Certainly the vaccine does reduce your risk of severe illness, but again, just because the virus is one that changes, and so it's very difficult to understand or to predict this year about its effectiveness. But right. In the past, it certainly has reduced the risk of severe illness.
Yes, thank you very much.
Thank you very much, Councillor Fillion. And the memo on how the incremental effect of that third or fourth booster, I think we probably all want to see that data. We're asked for it often. Okay, next is Trustee Donaldson.
Thanks very much, through the chair. I just have one question, and it's about the, thanks for the presentation, by the way. It's about the childhood immunization assessment, which you described as resuming and rescaling. for kids, for children and youth. And it sounds like there's been some really great effort on this and some headway is being made. So I'm just wondering, owing to the fact that this is our last meeting and Board of Health won't be meeting until the winter, what is the plan going forward? So how often are you going to continue to assess? If you do find deficits, is there a plan to address that in maybe a stronger way? And in general, how are you feeling about the levels that we're at right now relative to the effort since May? Thank you.
Mr. Chair, thank you for that question. So I'm very pleased that this just launched because frankly, professionally, I think all the associate medical officers and Dr. Davila have been concerned about the potential for there to be less immunity and protection in the population for these conditions if we're not reminding parents of the importance of this intervention. So the current plan is that letters have gone out to grade 1 and 2 students. And that will continue through the rest of the fall, through this calendar year. And we would also like to include grade 11 and 12 students. The reason we picked those cohorts is the grade 1 and 2 students have not been assessed because, of course, during the pandemic, we weren't able to offer this program and they hadn't entered the school system when we were doing this routinely. The second focus on grade 11 and 12 is we want to catch them before they age out of the system. So that's the initial thrust. Over 35,000 letters are in progress of being sent out for grade 1 and 2. And we are pleased to see that parents are responding. They are submitting their records. We were prepared for increased call volumes and emails, and that volume has been manageable. So that's encouraging, I think, because it likely means that parents are looking for opportunities to get their child immunized if they're missing doses or to submit their records. I think we would like to see what the full picture looks like after those cohorts about next steps, whether that involves, again, another prompt to those cohorts or whether we feel the risk is such that we should approach other cohorts. So if you will allow us, I think we'd like to do that assessment and then come back with a recommended approach based on the data and response.
Thanks very much. Just a quick follow-up. In terms of instructions to families for where to go and get these vaccines that they're missing, is it their family doc or city clinics, or what are we telling parents? Thanks.
For you, Mr. Chair, again. These are routine childhood immunizations that are routinely offered in primary care. So family physician offices, nurse practitioners, community health centers, and we do want to encourage those strong links that people have with primary care to access those vaccines. Currently, they're not offered in our immunization clinics, except for the one of the versions of the meningococcal C vaccine because of its link, 1, to the outbreak, and 2, to our school-based program for grade 7 and 8 students. Frankly, our MICs right now are quite busy, and we just would not have the capacity to add a whole other set of vaccines in. So we are encouraging people to access primary care and walk-in clinics for these immunizations.
Thanks a million. That's it for me, Chair.
Thank you very much, Trustee Donaldson. Sue Wong, Director Sue Wong, over to you.
Thank you very much. Thank you very much, Mr. Chair. I've got a couple of questions for you, staff. I'm going to put all my question out, Chair, if that's all right with you. So I heard about the town hall meeting the staff is doing throughout the city. I want to hear from staff with respect to the diversity, reaching out to diverse Toronto to make sure these town hall meetings are done in translated services. So that's the first question. Second, I noticed on slide number 11, it talks about the various dosage have been given over from May 1st to November the 2nd. For future reporting, is it possible, for staff to present, to drill down some more the data involving children and youth? Because I know in the past, the board is concerned about the lack of uptake of the booster and the vaccination of the students and the children. And the last piece here, I noticed the staff in the reporting, so excuse me, the childhood immunization assessment information. Can we also not just only focusing on the Immunization Act, also update from the board, from the staff to the board about any kind of catch-up vaccination? Because I remember in one of the presentation by staff about the fact that the HPV vaccine has been reduced, or there are many students are not getting the second dose. So it's very important for the staff to update this to the board on future reporting. So thank you, Mr. Chair.
And Dr. Nakos, if you could speak a little closer to the mic. Thanks.
Okay, through you, Mr. Chair, I think the short answer is yes. I think we'd be quite pleased to provide reports on all those questions. I'll start maybe with the last one, and then I might need to be prompted for the others. So for the student immunization program, we have had a very impressive response to reminders to parents at the end of the last school year about the life-saving cancer-preventing vaccines that are offered through the school immunization program. That is hepatitis B virus vaccine, human papillomavirus vaccine, and meningococcal vaccine. So a reminder was sent out at the end of the school year, and parents were informed that they could come and catch up on these vaccines at our city immunization clinics, the fixed sites, as well as some school-based clinics and community-based clinics that were offered over the summer. And we had impressive turnout. I don't think we anticipated the response, and it was very encouraging to see that people took advantage of that. And I can't recall the scale of doses administered, but it was in the tens of thousands. So catch-up is proceeding, and of course, currently, the school immunization program is active in schools that are operating, in public schools that are operating currently this fall. So grade 7 and 8 students can get these 3 vaccines currently through TPH school-based clinics. I think there was a question about the amount of doses administered to children and youth for COVID-19 vaccine. So certainly it's probably easier to bring that forward in a graph. We have seen that the uptake in children and youth has in some sense been lower overall as the child's age group gets lower. So parents are making different decisions for their children depending on their age. And that is perhaps not a surprising finding. We have listened to what parents have said. Many of them are well informed. They're making decisions based on their own experience of COVID and their experience with vaccines. I am encouraged that our immunization rates for COVID in 5 to 11-year-olds and in children under the age of 5 is actually either leading or as high of any of the jurisdictions in the province. So although it's not as high as in older age groups, I think we really have offered robust access and opportunities for people to learn about the vaccine. And accordingly, that helps reduce their chance of severe illness. I'm sorry, I think I have to be prompted on the first 2 questions.
So perhaps I can help out here. Through you, Mr. Chair, I believe the first question was with respect to the town hall meetings and the diversity. And certainly, you know, I myself was a recipient of a call to attend a town hall. So it is a very broad swath of the population. Truly, I think everybody in the city 18 plus is receiving a call in respect of opportunities to participate within the town hall meetings. With respect to translated materials, we continue to have services available and information services available to the public with translation support available as well. I would be remiss, of course, if I didn't didn't mention our community ambassadors who continue to work throughout the city and provide services and information and supports regarding COVID-19 and vaccine in a multitude of languages. So we are using the resources that are available to us as Toronto Public Health and through the city network, but as well using our community supports to help provide the information to all the different communities and diverse populations that make up the city.
Great, thank you. Trustee Huang, anything else? Oh, actually, well, we can give you a little break if you have any more questions. Trustee Huang.
No, I'm done. Thank you, Mr. Chair.
Okay,
Thank you.
Thank you. Okay, over to Director Dr. Kate Mulligan.
Thank you, Mr. Chair, and I'll just sneak in a thank you to Dr. Davila and your team and to all the board, because this will be my last official meeting as a board member, although I understand there might be one or two more until we get a new board underway, but thank you to everyone, especially those public members who are really representing your community, and I'm looking forward to seeing an even more representative board next time around. I have a few questions that build on Director Wong's questions about children and youth. It's something that's in the news a lot, and parents are really concerned about the increasing rates of childhood respiratory infections. Do you have any data about what's going on with kids? What do the pediatric cases look like for flu, RSV, and COVID right now?
So through the chair, Director Mulligan, I'll try to give that a little bit of an answer. I'll do the best I can. I will admit I am just back in the country as of yesterday, so I admit my knowledge is not as up to date. Certainly we are seeing a lot of respiratory activity in younger populations, and that's been going on for a number of weeks now. Even before I left the country about a week and a half ago, we were getting reports of hospital emergency departments finding themselves quite overwhelmed with respiratory disease cases, sometimes a combination of COVID, influenza, respiratory syncytial virus, and other viruses that are actually affecting our population. We'd be happy to come back with further reports. I don't know whether Dr. Finkelstein or Dr. Lamptey have anything further to add, but certainly there are challenges within healthcare, no question, around the demand for services in acute care.
Through you, Mr. Chair, I think what will be more evident soon is we do plan to share some of the information about respiratory activity in an integrated way on our public website. That's under development. I would just note that RSV individual cases are not a reportable infection, so public health wouldn't necessarily be aware of the volume of RSV cases, but RSV outbreaks in institutions are reportable. So in an integrated way, what we'd like to do is to be able to share confirmed outbreaks of respiratory activity in institutions as an indicator of what virus activity looks like in our city. For COVID-19 information currently, that is available on our website. We would like to add influenza and other respiratory conditions to the information we present. So that's coming very soon this month.
Your first slide also had some, tried to visualize some of that, if I remember right.
Yes, thank you for that reminder. Yes, at a national level.
Yes, at the national
Thank you very much. My next question is about, just following up on that, I just want to clarify, is the data available on the COVID dashboard now by age, as we're starting to see more interest in children and also older people?
So through you, Mr. Chair, yes, in terms of confirmed cases, but I would just remind the board that the eligibility for testing for COVID-19 confirmation has changed since the spring. So of the people who are eligible who can get a test to confirm it, yes, you can look at it by age on our website.
Okay, thanks very much. It would be great to see at the next board meeting some age breakdowns in what we do know about these respiratory viruses. I think it's an important equity consideration for the board to consider. I have a question about COVID vaccination in primary care. And I don't know if this is something you have any jurisdiction over, but if we're encouraging people to go to primary care for those routine childhood vaccinations, are they eligible to get COVID vaccinations in primary care? And if not, what's the barrier and how can we remove that barrier?
Through you, Mr. Chair. So Toronto Public Health has been encouraging all sectors of the clinical system to become part of the Team Toronto effort, and that includes primary care. So there are certain primary care practices that have enrolled with us to be able to receive COVID-19 vaccine and administer it to their patients. And that is done on a practice by practice, provider basis. And we have heard from them that there are some challenges. Just the scope of their work right now is quite broad. Just like the rest of the clinical system, they're trying to catch up on a number of issues. And so COVID vaccine is one of many things they can be doing. And we've heard that some of the administrative components of it can be challenging. So people can receive COVID-19 vaccine from their primary care provider, but not all providers have participated in that. I hope I've answered your question, or was there another component?
I think you have, thank you. I just have one more question, Mr. Chair, if that's okay.
Yeah, go ahead.
Dr. Finkelstein, you mentioned the layers of protection that are important for preventing these respiratory viruses, and you said to wear a mask if you feel comfortable. At what stage, at what data point would TPH consider reinstituting mask mandates rather than individual advice to wear masks if we feel comfortable?
Through the chair, thanks for that question. I think masks have shown over the last 2.5 years to be an important component of protection against respiratory viruses, including COVID-19, and that's why they were included in the layers of protection. I think right now, Toronto Public Health is being guided by provincial colleagues on the use of those layers of protection, and we continue to be guided by their direction.
So just to follow up, Dr. Davila, would you consider reinstituting mask mandates now, given the severity of concern around childhood respiratory illness?
So through the chair, I think at this point in time, as you heard from Dr. Finkelstein, we're in support of following that which the province is guiding us on. Of course, if the situation changes, as throughout the entire COVID response has been, if we see something different that necessitates a different course of action, and we will take that course of action. That has been our approach throughout the entire COVID response, is to use the best available evidence to guide the actions and to respond to what we actually see on the ground. So at this point in time, we're suggesting continued adherence to provincial guidance. But as we have seen over the course of the past several years, this virus has thrown some curveballs our way, and we have to be prepared to respond in accordance with that.
Okay, so just to re-ask the one question, what would that signal be on the ground? Do we know what that signal would be where we would take that action?
So through the chair, I don't know that there is a specific defined point. Certainly we would be looking at things like the severity of illness and the impact on health care, to say nothing of the impact on individuals themselves. So I don't know that there is a specific threshold on any one particular indicator. It would be the entire, sort of the totality of what we see on the ground and the potential benefit that would be derived from having a very specific mask mandate.
Thanks.
Okay, thank you, Dr. Mulligan. I put myself on as the last questioner, and it actually is in light of, in the same vein as Director Mulligan. I did notice on that very strong academic source Twitter last night that actually the Public Health Board of Ottawa is pushing for a masking mandate. Maybe they moved something. I didn't have a chance to actually dig deep into it, to be quite honest. But I am wondering, I think where we're at now is our message to the public is wear a mask if you feel comfortable. Is it possible between a mask mandate and frankly, I would say we're at the modest, even light encouragement of it, to push things along? Is it appropriate? And is there flexibility within the context of the province really defining what happens when, to push it along and saying we strongly encourage, we really think this is the moment? Messaging like that to signal to our Toronto public, which is different than other publics where we live just a little more cheek to jowl in this society, especially in subways and in large apartment complexes and so on. Is there room there to consider, and are you folks considering that?
So through you, Mr. Chair, I think we've heard from my colleagues this morning about the benefits of masks and what we have observed over the course of the COVID-19 response. And I would suggest this. First and foremost, we are absolutely, as we have throughout COVID, speaking to the benefit of masks, and in particular for those who are at highest risk of illness, who are perhaps most susceptible given their pre-existing conditions and are prone towards severe illness. And as well, we talk about the kinds of circumstances where transmission is likely to happen. Closed spaces without good ventilation that are crowded with lots of people. We know those are circumstances where, in fact, masks are likely to provide greater benefit than, for example, an outdoor environment that's not especially crowded. So we're encouraging people and would strongly recommend that people use those masks, again, depending on what their circumstances are themselves from a medical perspective, and an individual risk perspective, as well as the situation in which they find themselves. I would also suggest this: when we look at jurisdictions around the world, there are many places where they do live, in fact, cheek by jowl, if I may borrow your words, Mr. Chair, where people do routinely wear masks in the respiratory virus season without need of mandate. And, you know, my hope is that we're able to really encourage. We've seen over the course of the pandemic how well Torontonians have been able to adhere to, you know, good practice, good COVID-19 prevention, you know, over the course of the pandemic. And my sense is that we should be able to re-engage that kind of community spirit and approach in seeking to prevent COVID-19 transmission and certainly to preserve our healthcare system as much as possible.
Thank you. Okay, any other questions? Seeing none.
I have one, sorry, Mr. Chair.
Oh, my apologies. Trustee Lepreti.
Thank you so much. And through you to staff, I know that this is beyond your jurisdiction, but I'm gonna ask the question because there's nothing worse right now for parents than having a sick child. And right now, finding relief for our sick children is impossible. We've been going to pharmacies. There's empty shelves everywhere. We can't get our hands on Tylenol. There's social media groups. I mean, we have personal chats going on. There's a lot of sick kids out there, and we can't find even Tylenol to help these kids find the relief. I know that it is beyond our jurisdiction. I know that there may not be much that we could do as a board, but I think that it's really important that, you know, we've moved mountains before. What can we do in this situation to help parents help their children during this flu season?
So through you, Mr. Chair, perhaps I can take a first stab at answering the question, and I'll leave it to my colleagues if they would like to make any additions or correct me where I might misspeak. So Trustee Lepretti, I appreciate, you're right, it's not within our jurisdiction, but I do appreciate that this is clearly a concern for parents of younger children. And I know that you know, in respect of moving mountains, there are potential solutions that I know that pharmacy colleagues are working on around trying to, you know, create children's formulations out of, you know, existing supplies of adult medication. That may sometimes be an option, again, depending on the pharmacy in question. But certainly what we can do as Toronto Public Health staff is to raise the issues with the relevant folks, whether it's at the provincial or federal levels, to see what more they might be able to do. I think there are also some non-pharmacological interventions that are available and that I know are being provided, you know, through chat groups and through healthcare providers as well. Things to help ease the discomfort associated with illness that don't necessarily rely on medications, even if they are over-the-counter medications. So I think through the combination of these options, we can certainly support as best as possible, even though this is something outside of our purview and mandate.
Thank you. I don't have any further questions. It's just this is something that's really causing a lot of anxiety for a lot of for a lot of parents with school-age children or preschool, because we can't find anything on any shelves anywhere. Just simple Tylenol has become a huge concern. So thank you, and any help that you could provide, I'm sure would be greatly appreciated. Thank you.
Thank you, Trustee Lepretti. Okay, to speak. Anybody want to speak on this topic? Dr. Mulligan? Anybody else? Okay, I'll speak at the end. I have a motion to just kind of move it forward to the next meeting. Dr. Mulligan, over to you.
Thank you, Mr. Chair, and actually just submitted a motion to the clerk. So I want to make sure that it's okay for me to read that out. Here it is. That, you know, to reduce the spread of respiratory viruses and protect the capacity of pediatric healthcare services, that we as the Board of Health request that the Medical Officer of Health urgently explore all avenues toward reissuing mask mandates, starting with schools. Can I speak to that?
Yes,
Mr.
absolutely.
Chair?
Yeah. Please do.
Yeah. So I mean, I'm a parent of young children, and had my own very terrifying experience having to rush one of them into the resuscitation room of our local ER. And I shudder to think what might have happened if that resource hadn't been available. And it was a very scary experience as a parent, and I'm only one of thousands of parents who are finding themselves in this position right now. And unfortunately, our presentation this morning didn't mention children. And I think we really need a renewed sense of urgency. We don't have all the data as the board to you know, from my perspective, to ask you directly to reissue these mandates, but I would like to ask you to explore all avenues toward this reissuance and to consider the significance of this new experience for thousands and thousands of parents in Toronto is something that's causing a lot of concern and could be mitigated through simple mask mandate. So that is my motion to this board. Thank you.
Thank you very much. Are there any other speakers? Okay, thank you.
Trustee Lepretti will speak.
Trustee Lepretti.
Yeah, thank you. As a board, we've gone through numerous conversations with parents about this issue, and I won't be able to support it because at our school board, at the Toronto Catholic District School Board, we do encourage the masks, but parents feel really strongly against mandating the masks. So I won't be able to support it, but thank you for the member for putting it forward.
Any other speakers? Okay, I have a motion to basically request the medical officer of health. This is the, what I would call passing on of the baton motion. Request the medical officer of health to report to the Board of Health in the winter of 2023 with an update on the respiratory season in Toronto, including information on COVID-19 and influenza. I think that just have a little pause here. Okay, for those on the screen, there were some folks who came and went, and that's what that was about. That pause was about. So the motion is to report to the Board of Health in the winter of 2003 with an update. And the only comments I would make is, well, first, it looks like we have really good positive signs on meningococcal and monkeypox, real good success there, and hats off to you for managing that well. It seems that sometimes it's a little bit like whack-a-mole. You've got a few things under control, and it's very good to see as well that student vaccinations are rising fairly quickly, and that's also positive. The two areas seem to me is around children and respiratory illness related to children, and also maybe some emerging need to think through strengthening our approach to masking. And while I'm not moving any motions on it, it's something that other than Director Mulligan's, I do think that, and I do think that that's worthy of support. I do think that public health staff would be wise to pay attention to those issues, as I am sure you are. So those are my comments, both thanks, and just trying to pinpoint where some additional work in monitoring needs to happen in the next little while. Okay, are we okay with voting on both motions, or shall we separate them out? Both motions together?
Would we be able to separate them? Can we separate them?
Okay, yes, we absolutely can. Okay, we'll start with Director Mulligan's motion. I'll put that on the screen. Okay, all in favor of that motion, so indicate. 1, 2, 3, 4, 5. Opposed? Okay, that carries. The second motion is it's called the pass the baton motion. All in favor? Opposed, if any? That carries. That carries. Okay, so that dispatches that particular item. We are on item number 2 and 3, and I understand there's a joint presentation from staff and on the operating budget submission and on the capital budget and plan submission as well. Over to you, Dr. Davila.
Mr. Chair, before we go to the presentation on a point of order or just a question, I do have some questions about the in-camera portion, so I don't know how you want to handle. Okay.
Yes, so first thank you for that. So first we'll get the presentation from staff. There are no deputants. Then we'll go into camera if requested, and I think you're requesting that. Then we'll go back into public. Okay, so over to Dr. Davila.
So thank you, Mr. Chair. I will let my colleague Althea Hutchinson, who is our Director of Finance and Administration, take us through the presentation in respect of the 2023 operating budget and the 2023 to 2032 capital budget and plan. We should get the slides up and running for you very shortly, and we will take you through this presentation. So over to you, Althea.
Thank you, Dr. Davila. Sorry, I'm just going to see if I can adjust my chair. So today I'm going to take us through a couple of things to talk about, both our operating budget as well as the capital budget that has been put forward for 2023. So in today's agenda, I'll be talking about the value of prevention, an overview of our 2023 operating budget submission. Then I'm going to take a bit of a turn and I'm going to look at our operating budget from a different viewpoint. We'll be talking about our people resources, our service levels, and finally, our 2023 to 32 capital budget and plan. Next slide, please. So in previous presentations to the Board of Health, Toronto Public Health has talked about the value of prevention. Public health has a long history of advocating for changes that have had significant impact on the health of our citizens and the population at large. When done right, public health actions prevent things from happening, which in turn yield positive health outcomes, and at times is the most financial prudent course of action. Next slide, please. So studies have consistently demonstrated that investments in public health provide value for money and cost savings. On the left-hand side of the chart are actions or interventions delivered by or through public health. On the right-hand side of the chart are interventions or services delivered in other sectors of the healthcare system. Public health actions are comparatively less expensive than what happens when people engage with other sectors of the healthcare system. Point of example, to immunize costs less than the cost of actually having a hospital care for a severe case of COVID. As well, for the cost in terms of doing tobacco intervention is significantly less than actually having to be treated for lung cancer or other smoke-related diseases. Next slide, please. This information graphic, while a little dated, still holds true in demonstrating the return on investment of public health programs and interventions. Levers like policy, communications, and interventions have historically contributed to a reduction of diseases. Diseases like measles. Pre-COVID data noted an overall decrease in measles cases from 286 in 1995 to 5 in 2017. In addition, the last available data on the overall smoking prevalence in Toronto noted a reduction in smoking prevalence from 22.5% in 2021 to 14.5% in 2016. Next slide, please. I'm now going to be moving into discussing the actual operating budget that we are putting forward. Next slide. So I want to provide a little bit of context following some discussions that we had at the Board of Health Budget Committee back in July. So at that meeting, we talked about the ongoing, the province providing ongoing mitigation funding. That has been confirmed by the province through a press release at AMO. They will be providing public health units with funding to December 2023. The other thing that we've heard from the province is that they are going to be providing the opportunity for all public health units to request cost reimbursement for the COVID-19 general response, as well as the immunization cost, the immunization campaign. The Ministry of Health we also want to note something with the Ministry of Health. So Toronto Public Health has multiple channels of communication with our counterparts in the Ministry of Health. We also have routine check-in points with the ministry regarding our budgetary needs. And I want to note that should our situation arise where the assumption we've made regarding our 2023 operating budget changes, we will be using these channels and these check-in points to seek additional funding as needed. Next slide, please. So I'm not expecting you to look at the details of this. It's just a recreation of something that's actually in the report. It's table 1 for the report. The reason why I brought this slide up is I want to just kind of talk about why is this chart in the report. So for people like myself engaged in finance, we always like to look at, what our budget was when we got approved last. So you'll see that there's a line item there that indicates what was our budget when it was approved. And during the course of the year, there are other adjustments that happen. That sometimes we come to the Board of Health for approval for, other times it's not necessary because we've already have a base budget built in. And then we end up with what we call our actual 2022 approved operating budget. After that, for transparency reasons, we like to tell the board exactly what has happened during the course of the year, what is changing in our base budgets. And that's what's been outlined in table 2 of our report and here and on the next slide for the Board of Health. Next slide. So what I'm going to do is I'm going to take us through a couple of all the items that are listed there to give you some more context in terms of what has happened and what actually is in our 2023 budget. Because remember, these are just the incremental changes. It doesn't really give you a full picture of what exactly is in the 2023 budget. So next slide. I'm going to start off with the Ontario Seniors Dental Care Program. So this program, which was launched in 2019, has seen a 17.3% increase in its budget, or $2.7 million. In the 2023 operating budget, there is $18.3 million for the Ontario Seniors Dental Care Program. In addition to receive these increases, for the last couple of years, we've also had the opportunity to receive capital dollars from the ministry as well. And that's allow us to renovate some of our existing clinics, update our equipment, make sure that we're in compliance in terms of IPAC. We've been able to open new clinics and work collaboratively with our community health centers to ensure that they can continue to deliver dental services to Ontario seniors. The other thing that I want to note is the student nutrition program. As in previous years, we are putting forward an increase to our student nutrition program for the year-over-year increase in the cost of food and the economic factors. That equates to $0.8 million. And so in the 2023 budget, there will be $17.6 million for the student nutrition program, and that's inclusive of the funding that we provide to independent schools. Next slide, please. In that continuity schedule, you'll note that there is a reduction of roughly over $5.7 million. And that's related to some budgetary items that we brought forward in 2022. Those items were contingent on receiving funding from other orders of government. Unfortunately, we were unable to secure that funding in 2022, so we've removed it. But do not be alarmed. We will continue to advocate for funding. And in the event that we do receive funding, as in other years, we will come forward to the Board of Health indicating our success, and then we would increase our budget accordingly. This is exactly how we dealt with the IOT program, which was launched 2 years ago. We got the funding midway through the year, and we came forward to the board to announce the request that the board incorporate into the budget. The other significant reduction that's actually happened has to do with the funding that we get from the Ministry of Children, Community and Social Services. So outlined in the report, our Early Abilities program, which used to be delivered by Toronto Public Health, has transitioned to a community-based organization who continue to provide the service to Torontonians. That resulted in a 13.9 reduction year over year to our budget. But we still have $19.2 million in our 2023 budget for our Healthy Babies, Healthy Children's program. Next slide, please. We also see in our continuity schedule a reduction for the Toronto Voluntary Isolation Center. So in the 2022 budget, we have 12 months worth of funding to support that program. In the 2023 budget, we only require 3 months worth. Our agreement with the federal government comes to an end on March 31st, 2023. So in this budget, we have enough funding to take us through to that period. And I'm going to turn my sights now to the COVID-19 funding that we get from the Ministry of Health. So the school-focused nurse initiative, we've received information from the province indicating that that initiative will be continued to be funded until the end of the 2022-2023 school year. So in this budget, we have $5.9 million for 102 FTEs to support that program to the end of the school year. In terms of the COVID-19 general response, we have an annual budget of 49.1%. In the continuity schedule, it is a reduction year over year. However, I do want to note that it is still close to $50 million that we have and 386 dedicated staff that we've hired to support our COVID-19 response. We're right-sizing our response, as some of the previous speakers have spoken to. Dr. Finkelstein in particular, he mentioned that, not are we only continuing to look at COVID, but we're also looking at, the resumption of some of our non-COVID programs. So at this point in time, given the assumptions that we have made about how next year will look, we're thinking that we require $50 million versus the 59 that was there before. The reduction is actually really linked to some of the one-time costs that we had to incur at the beginning of COVID. We had to staff up, and when we staffed up, we had to actually purchase quite a lot of equipment to allow that staff to work remotely. And we also had a significant draw on PPE. Those are things that we no longer need to be providing anymore, so that also contributes to the year-over-year reduction that we're seeing. And finally, new this year, we put in a budget for our mass immunization initiative. In previous years, we actually didn't budget for it. The times we didn't know where we were going to be, we didn't understand how long the campaign would last, but this year, for the very first time, we have put in a budget of request of $36.9 million. That funding will take us to the end of June 2023 for this particular program. As I previously mentioned, there are multiple channels that we have, and as other speakers have said before me, we pivot and we change. If the need changes, if the circumstances change, if the assumptions that we've made don't pan out and additional funding is required, we will certainly re-engage with our partners with the Ministry of Health to ensure that Toronto Public Health has sufficient budget to take us through an immunization campaign. Next slide. And then there are the standard budget adjustments that we do. So every single year we have inflationary and cost of living adjustments, predominantly linked to staff moving up the pay grid, as well as any negotiated increases through our collective agreement. And we also have every year some administrative and technical adjustments. There are two of significance that I would point out this year. One is for capital, and that's just an accounting adjustment that we use in terms of how we record staff who are engaged in capital projects. And the other one is a $1.3 million increase that we did receive from the Ministry of Health in 2022. And that funding is going to be used for other inflationary costs, pressures that are beyond salaries and benefits. Next slide. So I have gone through the continuity schedule, and in there I've spoken a lot about lots of different things: COVID, the isolation center, the reduction or the loss of the program or the transfer of the program for early abilities. So what that does, I think sometimes it complicates things for the non-accountants in the room. It makes it look like we've got a very complex budget, and it looks like a reduction in terms of what we do for our normal programs. So I wanted to present to the Board of Health a different viewpoint. What would our budget look like if we were not in COVID? What would happen year over year, and how would that play out? Next slide, please. So again, I'm showing you another chart because I want to be transparent about what the numbers are and how we've moved there. And I'll spend a little bit more time on this particular chart because it's not in the report, and I do want to spend some time here. So we start out with the exact same number as what was in Table 1. It is the budget that was approved by City Council. And then I move to restating our budget. What would our budget look like if we did not have COVID? What would our budget look like if the budget that we put forward in 2022 wasn't obscuring our budget because we were unable to secure the funding in this particular year? What would our budget look like if a program that we have with SSHA, which was started through COVID, wasn't there? What would our budget look like without TVIC? And that's what you're seeing there is I've taken our 2022 budget and I've removed all those budgetary items to restate what would Toronto Public Health's budget been if we were just delivering non-COVID, our standard routine programs that we have delivered for years and will continue to deliver. Next slide, please. So we have a restated budget. Let's take a look at what's actually happened in 2023 that impacts the programs that are non-COVID programs and the programs that we have run, that we continue to run, and the services that the population has come to rely on us. You'll see that the Seniors Dental Care Program is there. You'll see that the Student Nutrition Program increases there. The inflationary costs are in there. There's a technical adjustments are still there. And we also have a confidential program efficiency, which we will be discussing later on. And what you actually see is that we've got a different way of looking at the year-over-year change. And what you actually see is a 3.5 or close to $3.6 million increase, or a 5.2% increase to our budget. What does that actually mean? That means that from a budgetary perspective, we have sufficient funding to continue with the programs as if we were not in COVID. Next slide, please. So the largest budget item that we have is our salaries and benefits budget. It's our people resources. So I want to turn some attention to what is in our budget in terms of our people resources. Next slide, please. So in our budget, we have 2,310 full-time equivalents. That is actually made up of 1,924 permanent full-time positions. And those positions are the positions or the complement that deliver our non-COVID programs, or would deliver our non-COVID programs. We also have 386 temporary full-time positions. All those positions are in there and they are for COVID. On top of that, but not reflected in the number, is that we have a significant complement of part-time positions. Those part-time positions are staff that we have hired specifically to deal with COVID-19, as well as our immunization campaign. These staff do not work full-time hours. They will work anywhere from 2 to 4 days on average in a week. So you will see that, and I want to also mention that even though we have 386 temporary full-time positions and part-time positions dedicated to our COVID-19 response, that is not the totality of what we have. We still have significant, anywhere from 200 to 250 on any particular given day, of our permanent staff who are redeployed and continue to work within COVID. In addition to those staff, you have staff such as myself and the finance team who support both sides of our house, both our COVID house and our non-COVID house. So there is still a significant contingent of staff who are engaged within our COVID-19 response. The last point that I have here is the exit rate and vacancy discount. And I'm going to go a little bit slower here because I'm going to throw some math concepts in. And so the exit rate is calculated as the number of staff who leave your organization as a percentage of the total number of staff that you have approval for. So historically, the exit rate for Toronto Public Health has run anywhere from 9 to 10%. And the reason why that's important is, in this context of this particular budget, is that at any given time, Toronto Public Health does not have a full complement on staff. And this is the reality when you are in a competitive labor market. It takes individuals have opportunities elsewhere, others want to come to you, but there's a gap. There is a gap in the time that when somebody leaves the organization to the time that you can actually hire and recruit them and bring them on board. And that gap is actually dollars, it's salary and benefit dollars that you are not spending. And that sometimes is referred to, and it's baked into a budget as a vacancy discount. Now, the City of Toronto historically has used other nomenclature, but I have been an accountant for many, many years, and I've only ever known it as a vacancy discount. And it is a norm that is built within, in my experience, in the public sector. So what is that vacancy discount? So in 2019, which is the last pre-COVID budget that we had, our vacancy discount was 6%. I asked my staff this year to calculate and tell me how much is the vacancy, pull out COVID, leave it aside. What is the vacancy discount in this budget? It's actually 4.6%. So over the last 3 years, we've actually reduced our vacancy discount. I think that is and I know what that is. It's actually linked to the fact that we've gotten such a significant increase in funding for the Ontario Seniors Dental Care Program. Next slide, please. Service levels. As I indicated, some of my colleagues have already spoken. In particular, I think it was Dr. Finkelstein. He spoke to the fact that we are starting to resume some of our COVID-19, our non-COVID-19 programs. So if you go to the next slide, I'm providing yet another continuity schedule for you to look at, because you know I'm an accountant and we like continuity schedules. So you'll notice that our service levels going in from 2022, there were 52 that we're reporting on. This year, we're reporting on 51. Now, the reduction is just it's linked to the transition of the early years programs out of Toronto Public Health. But what I really want to focus on is the restart of programs. So you will see that from 2022, when we came to the board to present our service levels, to this service levels, we're actually restarting 10 of our programs. And I think that is significant for us. No, we're maybe not back to not being affected, because as I indicated, we are still very much still engaged in COVID-19, but we're moving in the right direction by restarting 10 of our programs, if at a lower rate. Next slide, please. So this is just a snapshot, so you don't have to go through the 18 pages in Appendix A of how many we are reporting on, and it also indicates which the total number that are not affected, which ones are lower, and then which ones are suspended. And as you will see, for our chronic disease and injury prevention, that program seems to be the one that we are having, that we are not returning back as quickly as perhaps we would like, due to our continued response to COVID. Next slide, please. So that's the operating budget. I'm going to turn quickly to our capital budget and plan. Next slide. So in the 2023 budget, we have a budget of $5.1 million for our capital projects. There are 5 capital projects. I'll quickly just explain what they are, although additional information is available in the report. The very first one is $1.2 million for the Ontario Seniors Dental Care Program. As I indicated before, you know, the province has provided funding to Toronto Public Health to support our ability to expand our clinic space and renew our clinic space, and we'll continue to do that into 2023. We also we're wrapping up a program in terms of the electronic medical records, and that is going to support our sexual health clinics. We've got a brand new project, Infectious Disease Management and Surveillance Information, quite a mouthful, but what it is, we have a system that we currently use to track diseases of public health significance. During the course of COVID, the province did launch a new IT system called CCM, or Case and Contact Management. And what they have done is that they've made a decision that all public health units will be engaged with the province in moving from this old system that we've had for many years called IFIS to this new system for all diseases of public health significance. We have a project we're midway through. That's our inspections management implementation. That program supports all the inspections management that Toronto Public Health does around our healthy environments programs, such as our food safety, as well as the personal service settings. So the software that we're currently using has reached its end of life, so we're very keen to continue on with this particular project so we can continue to provide the inspections that we are mandated to do and that provide protection to Torontonians. And finally, we have our final one, which is our community health information systems. Basically, it's an upgrade that we're doing it's an internal upgrade that we're doing so that we're able to map our where we're delivering our services more appropriately. So it's a routine update. In terms of our total 10-year plan, we have a $31.5 million budget request, and we've got 16 projects. One of them is for facilities, which of course is the Ontario Seniors Dental Care Program, and 15 are for information technology. And as I indicated, additional information on all the projects are in the report. So that does take me to the very end of the presentation. And at this time, I will turn it to Dr. Davila for some closing remarks.
So through you, Mr. Chair, thank you, Althea, for the presentation. I think that summarizes very nicely for the operating budget and the capital plan for the next 10 years. We, of course, are interested in hearing your questions and are keen to ensure that whatever concerns or issues you may have are appropriately addressed at this point in time.
Great, thank you very much. We're going to, as requested, we're going to go into camera now to allow us to deal with the confidential matter. So I think there's a motion that we need to do that. I'll read it out, that the Board of Health recess its public session to meet in closed session to consider this item, that is 39.2, as pertains to personal matters about identifiable individuals, including municipal or local board employees and labor relations or employee negotiations. All in favor of that motion, opposed if any, that's carried. So if you need to be here, you're here. If you don't need to be here. I'll make an announcement. Okay.
Hello, everyone. This is Amanda Wall from the City Clerk's office. The board is now going to move into closed session. We will first suspend the live portion of the WebEx live stream. Anyone that is not needed for the closed session is asked to disconnect from the meeting. If you need to address the board after the board returns in public open session, please monitor the meeting on YouTube or on www.toronto.ca/council and reconnect once the board is back in public open session using the same meeting connection details that were provided to you earlier. The WebEx recording has been suspended. We are now moving all individuals into the closed session. Members, please do not begin any discussion until we advise you. Thank you.
Ready.
So I just have to real quick, because I've got to go. I just got to tell you, I've been in council for 16 years.
Okay, so we're ready to go. Are there any questions of staff on this item number 2 and 3, capital and the operating budget? Trustee Donaldson to start, and Councillor Perks.
Thanks. Through the chair. My question's about the school nurse school nurses funding, which ends June 2023, so the end of this school year. Do we have any data on the effectiveness of this additional funding, or if these nurses are performing any tasks outside of COVID mitigation? Thanks.
I'm so
Thank you, and through the chair. So our school nurses that we currently have for COVID, we are responding to recovery at this point in time, and it's included in the standards set out by the province that the school nurses can be involved in recovery, so working with the schools on mental health promotion and comprehensive school health. Additionally, we are using some of this funding to provide the student immunization program. We're doing 2 cohorts, grade 7 and 8, so there's a lot of catch-up that we are also doing, and education in the schools around vaccines. So we go beyond COVID mitigation strategies at this point. That's included in the work that we are doing, in addition to supporting the schools in general with their recovery and working closely with them. So yeah.
Thanks. Just a quick follow-up. And then in terms of the dental screening, do school nurses play any roles in that?
Great, through the chair, sorry, I was going to say, great question. So our dental screening program has restarted. That is our dental team that does that work. We did provide dental screening in our COVID vaccine and student immunization vaccines over the summer, and it was into the spring a bit too. So when we did go to schools to provide those vaccines, there was also a hygienist there that was doing the dental screening. So they have now worked on returning most of their staff to working on that program as it was before. So I don't think it's 100%, but they are definitely continuing with the dental screening.
Thank you. So on the dental screening catch-up that was required, because I know it was completely suspended during the pandemic, do staff feel that that catch-up will be complete by June 2023?
Thank you. Through the chair, I believe that those are the plans to ensure that they can turn up the program to the standards that it was pre-COVID, so that they can screen the children in the school setting.
Thank you.
Thank you. Councillor Perks, at the question stage.
So I have some service level questions, but before I get to those, I wanted to understand, because I couldn't find it anywhere. There's a term that we generally have used in budgeting, which is gapping. And I was wondering what the projected gapping percentage is for the 2023 budget in Toronto Public Health.
So through the chair, during my presentation, I talked about this concept of vacancy discount, which is different nomenclature for.
I understand, yeah.
It is going, we budgeted 4.6% in the.
4.6%. And if I'm not correct, if I'm not mistaken, the prior to COVID, back when you used to be chair, we had a target for that, excuse me, that measure of something like 2.5% to 3%. I can't remember exactly what it was.
Oh no, prior to COVID, it was significantly higher.
No, but there was a Board of Health endorsed policy that we should we should be aiming for. Joe, I remember you moving this, like I think it was 2.5%. You have no memory of that, eh? Maybe none of us remembers anything from before COVID. Okay. I do know that generally across other agencies and in the Toronto Public Service, we were aiming for 3%. something like that. Does anyone remember that except me? What was the city standard for gapping prior to COVID?
Through the chair, I would not know. I'm sorry.
Well, you're going to have to take my word for it then. It was 3%. Okay. So that one's going to bear a little further investigation. To the medical officer of health, I've been going through the 2023 service levels. And first of all, the fact that you're able to even find the time to produce this report in the middle of a pandemic is remarkable. So please don't take any of this as any kind of criticism. But I want to make sure I've understood. There are various notes and standard responses. One of the notes basically states that in 2023 you won't be able to deliver this program because staff have been reassigned to dealing with COVID. That's a common.
So through the chair, we still do have some staff redeployed from other public health work to COVID-19 response.
Right, and you're not budgeting to put people to backfill those positions. You're just keeping them unbudgeted.
So through the chair at this point in time, and Althea can certainly correct me if I misspeak, the way that things are set up in those conversations that we have with the province in order to get reimbursed for COVID response, the notion is first to use our base budget and then over and above, where situations require to adjust in accordance. I think.
So if I can restate that in a way a city councillor might understand.
Yeah, so.
See if I've got it right. The province is telling you that we have to take the money out of existing public health programs, not fund those existing public health programs, and transfer the staff over to doing COVID work.
Well, so I think that you've got most of it. The essence, though, is that you can't, we have a certain number of managerial and supervisory staff, so even bringing on people requires...
Can we get to that part of it, whether you can bring people on or not? I just want to make sure I understand the money part. So the province of Ontario is telling you not to deliver services that we used to deliver, and instead to transfer those people over to doing work on COVID.
So I think the way they would characterize it, and the way my understanding is that we're to prioritize and provide services that make sense using first our base budget and then apply to them for further.
So I'm just going to run down some of the things that are in that list, and if I've got any of them wrong, tell me. So we're not doing tobacco enforcement. Sorry, that's the wrong one. No, I've got that's for a different list. So we're not providing support to schools in figuring out what nutritious food is for the student nutrition program. We're not doing business continuity plans for the various departments and divisions within Toronto Public Health. We're not doing the full complement of environmental health testing at swimming pools and spas. We're not doing food education for vulnerable adults at community food markets. We're not doing West Nile surveillance. Those are ones that are listed as currently not funded because staff have been reassigned for COVID.
So through the chair, my understanding from staff is that we are in fact doing tobacco inspections. We did.
It's dramatically reduced. Yeah.
Yeah, so there are certainly, we're not able to do the fulsome program that we would have done pre-COVID, but we are, again, prioritizing to those areas and focusing on those areas that we see are most significant. The same can be said for recreational water. We certainly had a significant recreational water program, and the board may recall through an update that was provided, in fact, they had engaged in some novel technology to help support that program.
Yeah.
So there was some very good work done there. And I admit, I have to ask about food education. That sounds like something that we
This is
yes.
what I've taken directly from your service.
Yeah.
Okay. And then there's a second category where probably because your staff are worked to the bone and exhausted, where it says that the service standard level that we will achieve in this budget is not available to members of the Board of Health when we consider this budget, but it is available upon request. Am I getting that right?
So yes, you're right. We do have that note specifically in respect of assessment and surveillance. And again,
if I'm reading the budget correctly, you have that note appears 13 different times in the service standards. It's not just that one.
although largely it is with assessment and surveillance, there are a few other, and they are around data reporting, which comes back to surveillance and assessment.
Yeah.
And if I may, through the chair, the challenge there is that there have been new reports that are required through COVID, and we have the same surveillance and assessment staff. And on top of it, it is a pool of resources. It's a particular kind of staffing and skill set that is actually extremely difficult to come by at this point in time. So we have to adjust their workload in order to actually make it doable for them.
Right, but we're not budgeting to get those back up to 100%. We're actually budgeting to reduce the budget for that, so we're losing it out of our base.
No.
And so we would have to add it back. Yeah, that's going to be, this is how they report now at the city. We do year-to-year actuals. We don't have stuff hanging out there anymore like we used to. It says this is unfunded and we will put it into another year's budget. They don't let us do that anymore.
So through the chair, that is our current state because of COVID response.
I understand.
So our situation, as we progress through the pandemic and as our response needs change, will change over time. So I don't know that it's quite as cut and dried as that, Councillor Perks, but certainly we are interested in ensuring that we are providing information that is useful and valuable, but in a manner that's actually doable and frankly humane for our staff.
Okay, so I'll have to ask for another round after.
Well, okay, yes. Are there any other questions from other folks? Okay, back to you. I know you're setting up a motion, and
so
your point is
in that category we were just discussing, where the budget that this board is being asked to consider doesn't currently indicate what the service standard will be in 23. Among those are doing work with community groups around drug prevention, emergency preparedness assessment and surveillance, the epidemiology of emerging trends in priority populations for preventable disease, the beach rating, the data being posted for whether it's safe to swim at a given beach, information to pool and spa operators about transmissible diseases that are going around and how to keep their facilities safe, information, the ability to respond to information requests for lead in public and private drinking water, public awareness work on smog, flooding, and climate change, hot weather information for rooming houses and elder care facilities which don't have cooling systems, air conditioning in place currently, inspectors to go to such locations during extreme heat moments, monitoring for hazardous and priority chemicals entering our waterway, and pool inspections. All of those are areas where the service standard isn't available for us to consider here. Is that correct?
Through the chair, I think you're talking about the item on page number 6 of the appendix. Just to be clear, I want to make sure I'm addressing the correct.
So I'm looking at the column, the extreme right column in the 2023 service levels. Mm-hmm. If you go through the report, all of those areas that I just listed,
and the note says that service levels still being provided and tracked even though they will not be reported out. Is that the note?
Yeah, so I as a member of the Board of Health can't tell in those areas if we're delivering service to the same standard as we used to.
So through
from the data that's available to me here today.
That is correct. Through
okay,
the chair.
thank you. Okay, those are my questions.
Anybody else for questions?
Yeah.
Hey, so we're open to speakers now. I'm sure Councillor Perks, you're going to speak, and I also have a motion that I'd like to put on the table.
Okay.
Go ahead, Councillor Perks.
So I have 3 motions. The first is, if I could have it up so I'm reading the right one, that the Board of Health forward the report October 28th, 2022 from the Medical Officer of Health to the appropriate committee for consideration as part of the 2023 budget process. I'll explain that in a moment. Second, the Board of Health requests the Medical Officer of Health to report to the next meeting of the Board of Health on changes to the service standards resulting from the proposed 2023 operating budget. And finally, this is a request for the Medical Officer of Health to advocate with the federal and provincial governments on a variety of programs having to do with the drug poisoning crisis, the opioid epidemic. These are identical to a set of asks that the Board of Health approved a year ago, which the federal and provincial governments did not follow through on. I've shown it to the Medical Officer of Health and the Chair. We're all good on those. So if I can explain what the first 2 are about. So in front of you, you have a recommendation that we tell Toronto City Council, this is our operating budget and we're satisfied. That's what the report from the Medical Officer of Health says. Because I have these 2 areas, 3 actually, with the gapping, the other 2 that I discussed in questions where, for example, we don't have the data or we don't have the dollar value of maintaining a service standard. We just don't know. What I'm recommending is we tell whoever at the city is dealing with the budget, here is a budget for you to consider, which is not the same thing as saying we are recommending this budget. We then ask the Medical Officer of Health to come back in January, filling in some of those information gaps that I identified, so that the Board of Health, and some of us will be here, some of us won't, I might not be here, who knows, but at least the Board of Health will be in a position to better understand the answers to some of the questions that were raised here today before the budget is formally launched by Toronto City Council. So it says, you know, you have to do your work, Toronto City Council, on preparing your budget, so we'll give you this to work from, but we need to know more before we finally sign off. I've consulted with the Chair and the Medical Officer of Health on this, and they think that's a way where we can navigate handling the budget today, given that the city has its own timeline.
Thank you very much. Other speakers? I have 2 motions. One is around requesting the Medical Officer of Health to continue to advocate to the province of Ontario around cost sharing related to and funding related to COVID. And the second one, it's similar, it falls into the same line of what Councillor Perks' motion. Maybe it's redundant, but it says it in a different kind of way. So I would see it as augmenting that motion to request to provide an orientation and update to the new Board of Health on the 2003 budget process at its first meeting in 2023. And include the service level piece that Councillor Perks referred to, and comparing 2022 to 2023, and additional information on planned resumption of regular services. And I don't think I need to speak to this. We've had a good conversation around the question period. Any other speakers? Director Mulligan.
Thank you, Mr. Chair. I just want to endorse all the motions that are at hand and give my strongest thanks to you and particularly to Councillor Perks for going through that in such detail, especially as public members of the Board of Health. I think we often feel on the back foot when it comes to really understanding what's being presented and knowing when we can take the time to ask the questions we need to make sure we do have that full understanding. So it's greatly appreciated. Thank you.
Thank you very much. Anybody else? Okay, so we'll take them in the order that they were presented, starting with Councillor Perks's, I think it's A.
Mr. Chair, if it's fine with you, I can just vote on them all as a package. Vote on everything. Your motion's mine, all of it together.
Is there any desire from anyone to separate out the motions? There's 5 motions, 3 from Councillor Perks, 2 from myself. Any desire? Okay, you're good with doing it all as a package? Councillor Fillion, a package? Okay, so there's the package. All in favor of the entire package? All in favor, indicate with your hand. Opposed, if any? No one's opposed, marked as unanimous. Okay, that brings us to a close, and we'll entertain a motion to oh, number 3 as well. Sorry, number 3, that's the capital budget. Thank you very much. Appreciate this, staff. There's a staff recommendations around the capital budget. All in favor? Opposed, if any? That's carried. Okay, so that goes forward as is, and the other one needs some work with some additional reports, and the new Board of Health in the new year will tend to that. Okay, thank you very much, everyone. A motion to adjourn. All in favor? Opposed, if any? That's carried.
Thanks, everybody.